Tuck Dragon Flag. The Tuck Dragon Flag is a preparation exercise for the Dragon Flag. With the tuck leg Dragon Flag, you can adjust the load easily. In the beginning, the bent legs are very close to your chest, but eventually you should be able to straighten them and get it closer to your straight legs. The core muscles, with an emphasis on the abdominal muscles, move and stabilize the spine. The abdominal muscles contract dynamically for spinal flexion and statically to stabilize the spine. Note that the movement is preferred not only in the spine, but also in the shoulder joint. In other words, the shoulder extensors, mainly the Latissimus dorsi, strongly pull the body upward and during the descent prevent the body from falling down. The hip flexors are active statically to stabilize the legs. In order to understand which muscles are active, we must understand the movement of each joint and which muscle performs this movement. We also need to know whether the exercise requires the use of other muscles to stabilize the body. The movement in this exercise is done through the spine and shoulders. The spine performs flexion and shoulder performs extension. In this animation, we see the difference between performing the exercise when the main movement is spinal flexion and performing the exercise when the main movement is shoulder extension. In both cases, the abdominal muscles and the shoulder extensors, mainly the Latissimus dorsi, work hard. The difference is that in the variation where the movement occurs mainly in the shoulder, the abdominal muscles work mainly statically to stabilize the body, and the Latissimus dorsi is what creates the movement and elevates the body, as in the front lever exercise. This exercise is rated as very hard, therefore progressive preparation is required. The preparation will include basic plank and plank with shoulder extension exercises. After mastering the plank, we will practice a variation of the Dragon Flag with less weight on the legs. The more we bend the legs, the less weight will be on the legs. The same applies to moving the legs further back. A common mistake: heightened arching of the lower back, usually because of weakness in the abdominal muscles. The solution is to strengthen the abdominal muscles with a lower load, such as in a bent knee position. One of the common problems is neck pains because of high load on the cervical vertebrae and overextension of the neck when raising the body. It is possible to prevent or ease the problem by placing a rubber block or stiff pillow under the shoulders. The elevation will prevent excessive neck flexion and transfer the load to the scapula.